It's Wellness Wednesday on the Rickey Smiley Morning Show.
You better believe it, y'all. Hey, every Wednesday on the Rickey Smiley Morning Show is Wellness Wednesday. We got the one and only Dr. M.J. Collier is back to help you stay healthy. We just sent one of our producers to your office, Dr. Collier, because she was sick.
I know. I talked to her. We going to take care of her.
Yeah, tell her go straight to you. Don't go nowhere to go to Dr. Collier. We got a doctor on the show. We got time. Dr. Collier, happy to have you.
Happy to have you, Rickey. Thank you so much for the opportunity to bring healthcare information to the listeners of the Rickey Smiley Morning Show. Good morning, Rickey. Rock T, Special K, Gary with the T, Alfredas, and the Brat. So, Rickey, thank you again. And once again, Rickey, we have a celebrity who has announced a diagnosis of stage 4 prostate cancer. So this is becoming a regular phenomenon. So my prayers go out, and this is not, I'm not violating anything because this has already been in the news. My prayers go out to a Real Housewife of Atlanta, celebrity hairstylist Dwight Eubanks. He was diagnosed with a stage 4 prostate cancer, and this is a problem that we're having now. More men are being diagnosed with advanced prostate cancer today, Rickey, because they're delaying early detection screenings and only being tested when symptoms appear. The problem is that at that stage, the prostate cancer is it's much more difficult to treat and oftentimes incurable. So, we're just men are victims of a fractured system that we have now for the early detection of prostate cancer. There's kind of a conspiracy between the patient and the doctors. The doctors don't want to do it, and the patients don't want to have it done. So sometimes in the doctor's office, it's a don't ask, don't tell. If a patient doesn't ask for a prostate screening, the doctor doesn't bring it up, and it never gets done until there are symptoms, and then you have a problem. So, Rickey, the most important prostate, besides the digital rectal exam, which is very important, and you can see an example of the digital rectal exam on my YouTube channel that will tell you, ask Dr. MJ, you'll see what we're talking about and why we have to do that. The PSA, Rickey, that test was introduced as a primary screening test for prostate cancer in the 1990s. And guess what? They started doing that test, and prostate cancer deaths declined by more than 40%. Well, all this changed in 2012 when the USPSTF, that's the United States Prevention Services Task Force, which is not a group of doctors, okay, they released what is called a D recommendation that doctors should not provide the PSA test unless patients presented with symptoms of prostate cancer. And that was based on some flawed clinical trial data that they utilized and showed that there was no survival benefit for patients who received the PSA test. So common sense tells you that that was not the case. Since then, deaths from prostate cancer have been on the rise. In 2018, Rickey, they relented because they saw that the rates were going up and they changed the recommendation, but they still have not recommended that everybody get tested. They're just saying discuss it with your doctor and decide whether you want to have the test or not. So this has changed the practice of doctors. A lot of doctors, like I said, they don't want to take the time, or they have no desire to do digital rectal exams or PSA testing, so they don't do it. So in 2025, Rickey, the prostate cancer incidence is estimated to be about 300,000 cases, which is an 80% increase in cases since 2019.
Wow.
So that shows that, the prostate PSA test is very important and necessary to get patients straight. Now, we often hear the prostate cancer, well, it's a slow-growing cancer anyway. You're probably going to die from something else. Well, tell that to the 35,000 men who are projected to die from the disease in 2025, which is the second leading cause of cancer deaths for men behind lung cancer, which is number one in men and women. So the facts show that we have an escalating prostate cancer crisis in this country, and I'm glad that the Rickey Smiley Morning Show gives us a forum to discuss this disease state and get the attention of a lot of men. So listeners of the Rickey Smiley Morning Show, go to your doctor, ask for a comprehensive physical examination that includes a digital rectal exam and prostate check, and get the prostate PSA blood test, and then follow up on the results. And if the results are abnormal, then make sure you follow up on it. Don't just ignore. Right. I had a patient this week in the office, hadn't been seen by the doctor for years, heard me on the Rickey Smiley Morning Show, came in for a physical. Now, a normal prostate PSA, Rickey, is between 0 and 4. His level was 44. 10 times what it should. I mean, it was one of the highest I've ever had. And I told him, I said, one, I'm glad you heard me speaking. Two, that you took action and came in and got a complete physical done. And now we got to take action to get this treated and see what we have going on there. Now, that doesn't mean a PSA is not diagnostic of prostate cancer. But if it is elevated, you need to make sure that that's not the reason.
Okay. All right, Dr. Collier, we're going to take the calls on the other side. Y'all get at us 866-9 Ricky if you have any questions for Dr. MJ Collier. More Ricky Smiley Morning Show coming up.
The Rickey Smiley Morning Show, baby.
All right, y'all, Rickey Smiley Morning Show. Hey, y'all get in at 866-9-RICKEY if you have any questions for the one and only Dr. MJ Collier. Let's go to the phones. Good morning.
My question is, being a breast cancer survivor on the left side for 11 years, and then in the last couple of months been diagnosed with breast cancer on the right breast, genetic test done, no BRCA genes, no family history. What other tests should I be looking into?
No other tests are indicated at this point. If you've been diagnosed on the right side with the breast cancer, you need to have it treated and probably a lumpectomy. You've already had the left breast treated, and then that will probably relieve you of your cancer burden, and you won't have to worry about it. You've had all the diagnostic testing that you need. The only thing now are the usual and customary healthy lifestyle choices, including taking vitamin D3 at 5,000 international units per day. That helps prevent all types of cancer, including breast cancer, and that will give you your best option for doing that. That is an inflammatory condition, so other supplements like omega-3 fish oil will also help. But again, making sure your stress level is down and continuously monitoring with mammograms at least once a year. And you'll need diagnostic mammograms, not just screening mammograms.
All right, y'all, with Dr. Collier. Good morning.
Yes. How do I maneuver or manage mild schizophrenia without medication?
Oftentimes it requires medication. Counseling by psychologists is not effective with the diagnosis of schizophrenia, so it usually will require some type of pharmacologic. There are other things that might help, like CBD oil, etc., but I would say you need to be evaluated by a specialist, a psychiatrist, to determine what is the best treatment protocol for you or your family member or the person you're concerned about, because it's, schizophrenia has its cycles, and most people need to be medicated. They need to stay on the medication. The biggest issue is they take the medicine, they feel, quote, normal, so they stop taking medicine, then they cycle. And so this results in sometimes hospitalizations, and if they have major symptoms involving, legal situations and getting involved with the police and possibly being arrested. So it's very important to keep those symptoms under control so that the person can have a quality lifestyle. So schizophrenia can be well controlled with various types of pharmacological aids now, but I'm not aware of any effective natural ways of treating it.
All right, y'all, with Dr. Collier. Good morning.
My fiance has lupus, and right now she's having a very hard time where she's in a transition where her fingers are kind of like hurting and peeling. I wanted to see if the doctor had any remedies that we could possibly do to take away the discomfort and things like that for her.
The problem, again, is inflammation, and inflammation is treated with anti-inflammatories. Vitamin D being the natural anti-inflammatory, omega-3 fish oils, other supplements such as curcumin or turmeric, or other. There's a long list of anti-inflammatories you can Google on the internet. But also there's what has now become popular called the anti-inflammatory diet. So these are foods that you should add to your diet and or other foods that you should avoid that can aggravate inflammation. And so this is a chronic problem, and you need to appreciate that symptoms will come and go depending upon a variety of different factors, but you need to minimize the amount of inflammation, and that can actually be measured. There are two tests that I perform in my office. One is called a high-sensitivity C-reactive protein, and the other is called a sedimentation rate. And so both of those will determine how much inflammation you have in your body and whether you're responding to those therapies.
All right, John.
Okay.
Oh, go ahead. I'm sorry.
Okay, I'd like for the male and female listeners of the Rickey Smiley Morning Show to go to the Prostate Health Education Network, PHEN, PHEN, for more information on prostate cancer. I partnered with PHEN, an organization, president and founder, Mr. Thomas Farrington, a personal friend of mine and prostate cancer survivor, to provide education on prostate cancer targeting African-American men and men of color. That's PHEN, PHEN, the Prostate Health Education Network. And Rickey, congratulations on Foolish. Once again, your comedy special. I had a watch party at my home on Saturday.
I wish I could have been a fly on the wall watching you and your wife, because I know you be doing some laughing. And I know what joke probably got you, that stripper crushing them cans with her butt. I know that wiped you out, because I know your type of humor.
And the Thanksgiving menus, that's what really had my wife laughing.
Hey, what about Brianna? What Brianna had, Dr. Collier?
Follow me at Ask Dr. MJ on all social media platforms. And remember, these are the opinions of Dr. MJ Collier, not those of Rickey Smiley, the Rickey Smiley Morning Show, Super Dave, or his production crew. 6 days, don't you dare go away. You're listening to Dr. MJ on the Rickey Smiley Morning Show.
Hey, Dr. Collier.
Yes, sir.
Hey, Gary, where Brianna?
What's up? Get out of bed.
The Rickey Smiley Morning Show.
The Rickey Smiley Morning Show.